watching Parker Success Academy with Dr. William E. Morgan.
Hello, I'm Dr. William E. Morgan, and this is Parker Success Academy, where we explore models of business success in chiropractic practices. Today, I have a very special guest, Dr. Kevin Christie. Welcome aboard, Kevin.
Thank you for the opportunity. I really appreciate it.
So can you tell us a little bit about yourself and your practice?
Yeah, absolutely. I'm down in Boca Raton, Florida. I'm a native South Floridian, which there's not a lot of us. We're a very transient area. I went to Florida State University for exercise physiology, and then obviously graduated from chiropractic school at some point, and then been practicing since 2005. I've got my wife, Laura, and our first child, 6-month-old Brandon, who is a pandemic baby. He's doing great, though.
Wow.
Yeah.
So a pandemic baby. So that's awesome. Can you tell us a fun fact about you, Kevin?
A fun fact, I guess, is that I'm really a history buff. If I remember when I was making the decision in high school what career I wanted to be, get into, which I actually knew at 17 I wanted to be a chiropractor, and I stuck with it. But I really wanted to dive into history and be a historian. But I knew that was a tough road to go through. And but I travel a lot. I travel for history reasons. I've read books that most people wouldn't spend a half hour on, and I just really thoroughly like reading history, and I do a lot of that. So it's a little bit of a thing that most people don't know about me.
I love history too. What aspect of history?
I actually really enjoy military history, even though I wasn't in the military. I actually just finished a great book on General MacArthur and really enjoyed that. That one for me was interesting too, because my grandfather, who I never met, he had passed away before I was born. He fought in the Pacific under MacArthur, and for 4 years. So I always was interested in that particular general, and I read his biography, like 800 pages, and just amazing learning lessons you get from someone like that.
Truly, and I'm a big reader too. There's one book, if you're into history, this is historic fiction. It's called Once an Eagle. It's about 1,200 pages. It really talks about the leader who can see the moment, the opportunity during the battle that will change the course of the battle. And for me, it had lots of application as a university president and also as a chiropractor. So good leadership book, but also good historical fiction. Can you explain your business model to us?
Yeah, absolutely. I have a private practice. I've had my own practice for 10 years. Actually, on April 1st of this year was our 10-year anniversary. And we have a sports chiropractic practice. We really focus on, I would say, 3 main aspects of care: the adjustment, soft tissue, and rehab exercises. So most of our patients get that, and we really try to make sure we have a well-rounded approach. I've been very fortunate in the sports arena. I've been to the NFL Combine for 12 years as a clinical director for a training program down here. I've worked with multiple professional athletes. I was able to travel on a PGA Tour for a year back in 2011. And so I've really built my practice around sports injuries. Obviously, I see regular folks, but it's just really been fun to grow with what sports chiropractic was in, say, 2005 and what it is in 2020. The bar keeps on raising up, and it's fun to grow with that. So that's really what my practice model is like. But then I read an interesting book in the past that talked about building a little mini conglomerate as a small business owner. Obviously, I'm never going to be Amazon or Apple, but I tried to build that around rental. Like, I own my office space and I sublet out, so I've got some income going that way. I've obviously got my chiropractic practice. We do some things in the ergonomics and corporate space also, and then as many people may know, the Modern Chiropractic Marketing Group. But they all feed each other, and so as I learn a lot about marketing and I apply it to my own practice, I can then go to that audience and say, yes, this works, or no, it doesn't. And it all just kind of works together, and it makes it fun for me to have those different things going on.
That's great. Diversifying your income. I've often said that the most dangerous number in any small business is 1. If you have one source of income, if that goes away, you're in trouble. And for me, when I worked for the government for many years, so that was my one main client. So then I did seminars on the side. I had online education, online CE company I did, wrote books. So trying to diversify my income. It sounds like something you recommend. Once you get to that point in practice, you probably want to diversify out real estate and other things too.
Yes, and that's what I've done. But you're right. I wouldn't necessarily recommend that for the first year graduate.
So, in addition to chiropractic, what other therapies or professions do you have in your practice?
Yeah, so we've got a physical therapy group that rents from us, and then we actually have a sports recovery center in our office, and we started that in 2014, where we have a whole body cryotherapy chamber. We were one of the first to have that in South Florida. We've got a hyperbaric chamber, we've got the recovery boots, deep tissue laser, and so we package that as more of a sports recovery, not necessarily injury treatment aspect. And so if you're active, we've done a lot with the NFL, UFC, runners and triathletes, golfers. And so if you're just looking for improvement in your recovery, we offer that as well in our practice.
Well, that's pretty unique. So, what's your definition of success?
I actually love this question because obviously it's subjective, but I try to use a blueprint that I learned from Strategic Coach. And Strategic Coach is an entrepreneur coaching group. I joined them in 2013, and I've been with them ever since. And they talk about life's four freedoms because it's not always about money, right? But the four freedoms is freedom of money, but it doesn't mean you have to have a Lamborghini or three houses. It just means, there's a big psychological component to finances and money, but having that freedom of it to where you're not stressed about it, right? Freedom of time, and that's being able to spend the time with your friends, your family, or things you enjoy doing. Freedom of relationship, which can be, in my perspective, either, again, your spouse, significant other, your kids, your parents, but it also could be the relationships in your business life. Like, I don't want to associate with certain types of potential referral sources if I don't find them ethical. And if you can have the freedom of money and you're not like worried about it so much, you can make better decisions as far as the relationships you build to grow your practice that really serve you both ethically and from a growth standpoint. And then lastly, the fourth one is purpose and really being able to work within your purpose. I think as chiropractors, inherently healing people is quite a purpose. So we kind of have the edge up on maybe the plumber, right? In that regard. And so purpose is great. But then for me, by checking off some of the other boxes, like feeling pretty good financially, which has been able to allow me to use some of those financial resources to hire people and outsource to buy me more time. And now I'm only treating patients on Mondays and Thursdays, which I really enjoy those 2 days of doing it. But now I have Tuesday, Wednesday, and Friday to add a purpose in my life, which is helping chiropractors out with their practices and helping them grow. And so by really checking off the boxes of the time and money, it's allowed me to increase my freedom of purpose. So to answer your question in a long way is I feel like if you can get clear on those four freedoms and what that looks like to you, and you can start working towards achieving that, that would help define success for the individual, I think.
And it sounds like you have 3 days a week to be creative.
Yes.
So I always tell students that it's your responsibility to be successful because you don't want to make patient care decisions based upon your financial need. So it's important that you and I, and that's why we're having this meeting together, is to help those new doctors and doctors in the field become successful. So there's things that you bring to the table, marketing. Like you've written a book recently, published through Parker. Actually, 2 books. Can you tell us about those books?
Yeah, absolutely. It's a book and workbook combination. It's called Doing It Right: Modern Chiropractic Marketing, and it's really, in my mind, a guide to how to implement step by step marketing and some business strategies in your practice to help grow it ethically and do it the right way. There's nothing wrong with marketing. I think sometimes as clinicians we think of marketing and business as these things we shouldn't have to worry about. If you're a great clinician, everybody will be knocking down your doors. Unfortunately, that's not always the case for everybody. And so providing really good content marketing strategies and leveraging certain distribution channels and the modern technologies out there now make it so much easier than say 2005, even when I graduated. You can really position yourself as an expert in your community around whatever niche you want to have and really have a thriving practice that can then add maybe an associate to your practice because you've got a good marketing model that's feeding enough patients to support that person as well. And ultimately, if you've got good marketing going on without you having to kind of physically pull people in all the time, you'll be able to have a little bit more of a self-managing practice where you're not it's not based on your personality solely.
Well, it sounds exactly. It's like the e-chiropractic myth or the e-myth. Basically, are you working for yourself or are you self-employed? And so there's a difference. And so for you, you've gone past crooked pins and these other marketing aspects, but your books tell you how to do it, and the workbook allows you to work your way through a systematic program of marketing growth.
Exactly. We've got different tools in there that help you get clear on your marketing budget, your marketing plans, your how to really build your audience and define your audience and the different types of strategies around that. And so we really want you to apply this information. It's not marketing theory, it's actually marketing strategy for the chiropractic office. I think that's some of the missing links. So there's some great marketing books out there. I've read most of them. There's really good marketing theory books out there, but I haven't really, at least in my opinion, seen anything put it together for the chiropractor to be able to implement and feel good about it.
One of my favorite topics is talk about strategy. Most people, they are talking tactics when they're thinking, and they're talking strategy, and they're different. Tactics is something quite a bit different than strategy. That branding is different. And I always, if you want to know the power of marketing, you look at the large Coca-Cola and Pepsi companies. Essentially, they're selling sugar water. They're selling sugar water. It's the worst thing for you, and they're making billions of dollars, and it's all done through marketing. Not me, because I don't drink this stuff, but people buy sugar water, a particular brand, based upon this brand and market. And if you ever doubt the value of marketing, just think of that concept. That they're just reprocessing sugar water, and people buy it by the billions. So what's a book that you would recommend to our audience?
I've read a lot of them, but the one I would say for our audience of chiropractors out there, I really enjoyed, and I enjoy a lot of his books, but Ryan Holiday has a book called The Obstacle is the Way. And it's kind of there's a trilogy part to it. Ego is the enemy, obstacle is the way, and stillness is the key. But I think as a chiropractor, The Obstacle is the Way is a great book because I try to kind of reference that in my head whenever there is that big obstacle. And obviously this year in 2020, we've faced some obstacles. So I think that book really gives you kind of a nice operating system to get through the challenges that a 40 or 30-year career will undoubtedly have.
It's funny. I've done several of these interviews. That's the third time that book has come up. I've read it, and essentially it goes into the writings of Greek Stoicism and Marcus Aurelius. And basically, you treat success and failure the same, and it is a very good book, and it actually it's helped me with my decision making too. So I recommend that too. Ryan Holiday, The Obstacle is the Way. So what's been the worst moment in your journey as a chiropractor?
2015. I got out of chiropractic school in 2005. I worked for someone who was a great associateship. I think associateships are really good for chiropractors as long as it's a good situation. I had a good one. Then I was able to go into a partnership that worked out well, and to the point where I was able to open up my own practice in 2010. And I had a really good trajectory. Like, it was just a great 5 years. And then the kind of the hammer fell on me in 2015, where I've done a lot of on-site chiropractic at corporations. And one location, we were generating, quite a bit of a profit from that one location. And on April 1st of 2015, they changed CEOs and they dropped the program. And that was the same day Blue Cross Blue Shield of Florida started with ASH, American Specialty Health, unfortunately, and that cut our reimbursement by 45% on that day as well. And not only did that hurt my Boca Raton office and my Miami office, because we were in network, and that's the biggest plan by far in the state of Florida. But I had on-site corporate locations at ADT Security, Royal Caribbean, Tyco, and they were all Blue Cross Blue Shield as well. And we went through their insurance with that. And so just all across the board, 45%, plus I lost that corporate location. And you mentioned earlier about diversification. Luckily, I was pretty diversified. I would say my big mistake was I didn't catch what that cash flow implication was going to be in time. Like, it took me about 6 months to really realize the implications of it, and I didn't navigate it well enough at the time. And then finally, about 2017, I got my bearings straight with it. We've been amazed. Like, the last 3 years just been really good, but it was a painful 12 months without a doubt. So, be careful for those types of situations.
Be ready to pivot to something else, which my next question was going to be, what was a pivotal moment in your journey? But I think that probably was the pivotal moment as well.
Oh, it was huge, because honestly, what it did, Doc, was I built my practice being in network with insurances, and there's nothing wrong with being in network with insurances. But I had done a combination of building enough of myself in the community and like really developing my niche, and doing a lot of good content marketing to where I was able to actually withdraw from those plans and go out of network. And to this day now, like, if you looked at my clinic office visits now versus, let's say, 2014, we haven't added many more office visits at all, but the office visit average, like from a financial standpoint, is quite a bit different. So the top and bottom lines look better than they did in 2014. I think there's a lot of variables for a chiropractor to make that decision. So I can't say just do that, because I think a lot of practices that are in network are doing great things. So I'm not here to say anything about that, but that was a pivotal moment in my practice, was having to almost being forced to do it and making the decision to do it, and not sacrificing my level of care.
And we should almost anticipate these type of things.
Yeah.
So chiropractic marketing and advertising to patients has been a big topic. It's your topic. I'd like to get some pragmatic, some practical tips for our audience to learn from your expertise on marketing and advertising.
Yeah, definitely. Content is really where it's at. I want to give another story. You gave Coca-Cola, which was great, but the thing people don't realize about, say, Disney, is that their movies and their whatever, like the different content they have, is what it is, and it actually drives a ton of sales of their merchandise. And now it's driving a ton of subscription to their streaming services. So that's why you see them replenish some of their old movies, and then all of a sudden they'll hit you with all the clothes and merchandise that comes with it. And so the movies are really content marketing for all of the other stuff they sell. And now I think they're going to start creeping up on Netflix with streaming, and it's amazing what they've done with that. And so the moral of the story is we as chiropractors have such a unique knowledge base that we can educate and develop amazing content for our community that people need in their lives. Like, they need to know how to prevent low back pain, or what to do if they get headaches, how to do this stretch. Like, there's just amazing things you can come up with, and that's exciting for us. The knowledge that we keep on learning as providers can be then conveyed to the community. And if you do that consistently, you are going to have a following. You are going to build an audience. And one of the things that I saw with the chiropractors that weren't doing that when COVID hit, and they maybe had to close their practice, it was harder for them to get going again, because they didn't have an audience, and they weren't creating enough content, versus the ones that already did were able to kind of jump back into the normalcy quicker. And so start creating content. That's my first advice. My second is it's not always about new patients. We hear historically, you got to get new patients. We know that, like, obviously new patients are great, but if you provide really good content to your existing and past patient base, they will come in more often. They'll refer more often, right? If Bob is getting your weekly email on great content, and then his wife complains of headaches, and he just got that headache email from you a couple weeks ago, and he hasn't been in your practice in 8 months, there's a higher chance he's going to refer her in as a new patient versus if he wasn't getting any information from you, he probably would have forgotten. And so if you get that content in front of people and build that tribe, what ends up happening is you turn yourself into their chiropractor. There's nothing better than when Sally says, "Oh, you got to go to my chiropractor," right? And if you can get that many people saying you're their chiropractor, the referability goes through the roof. I would say a lot of chiropractors struggle when they don't ever get to that level where enough people look at them as my chiropractor, right? And so if you can get good information in front of your people that already know, like, and trust you, it's amazing how often they'll reactivate for new injuries. They'll refer more people in, and you'll start to see your office visits go up without having to get 70 new patients a month.
Have you ever heard or read the article or the book, 1,000 True Fans?
Yeah, I think it's Kevin Kelly, right?
Yeah. So you have a comment on that? Do you believe?
Oh, it's so true. And that's, frankly and candidly, what I did in my practice and what I've done with the Modern Chiropractic Marketing Group, and just really follow that kind of tribe aspect and really provide a lot of value.
So for the audience, what happens? The concept is, whether you're a musician or an author or a chiropractor, if you can, over the course of your career, develop 1,000 true fans who just love you. You might have other fans come and go out of your practice, but true fans who buy everything you make. So if I'm a musician, if I come up with one song a month, and they buy it all, you can make a living with that. For chiropractors, if you had 1,000 patients that you accumulate over, let's say, your 10 years, that want to come in periodically for maintenance care, they come in every month, your practice is full.
Yep.
You're seeking
Absolutely.
that 1,000, and I write books, but I also write fiction. So I'm seeking that 1,000 with a pseudonym. So that 1,000 fans will, if they buy my fiction, then I can make a living as a fiction author if they bought every book I ever did, and others along with it. 1,000 True Fans, great article, great book.
Yes, you can definitely Google that, and it is a great article.
Yeah. So what keeps you up at night?
Besides my 6-month-old son, I would say I suffer from a healthy level of ambition, maybe sometimes too much ambition, and I'm always looking to push that envelope, but it's served me well. And so sometimes my mind will kind of race on the things that I'm excited about doing, right? And that's really what I would say does keep me up more. I sleep a lot better now than I used to when I was, say, in my late 20s, not sure, if I was ever going to have my own practice or what was going to be my career. That was always a struggle. But I would say now it's just taming that ambition a little bit and really getting exciting about what the next 10, 15 years is going to bring.
Now, we at Parker frequently talk about the 10X concept, which is another book. What is something that you did in your business that had a 10X return on your effort?
Yeah, I kind of mentioned it earlier, but I purchased my office space. And when I opened my practice in 2010, I rented one treatment room from an orthopedic in this medical building, which, if you're trying to get your feet underneath you and open up your own practice, was a really good way for me to do it because I had very minimal startup costs. The orthopedic office was really nice. So people walked into a fully decked out office and gave me a level of credibility being in an orthopedic office. And so I was able to tuck away some profits for a few years, and a nice 3,000 square foot office opened up in the same building. And I was able to purchase that. And once I did that, because I had kind of hit a ceiling at that office with not having enough space of my own and all that. Once I did that, that's when I was able to add the sports recovery center. I was able to sublet some space. We were able to see more patients. And that decision has also helped financially over the last 7 years. The price of the real estate has increased quite a bit in my area. And I think it's going to be a very good retirement aspect for me. So it's not for everybody, but I think if you want to be in one location for a long time and you've got the financial resources to do it, it's a really good strategy to not only provide a ton of stability for your practice, but also growth and a nice little chunk of retirement.
I agree with that. And what you said earlier about going into an orthopedics office or another doctor's office, could be a chiropractor, there's tons of those available. A lot of doctors have space for rent. you can get for cheap. And as you said, you already have validation. You walk in, there's a receptionist. And we had one of the people we've interviewed, Margie Smith, was talking about the micro practice where she started off this way, where it's a really low overhead way to start.
Yeah, it was amazing. I didn't have to dish out. I didn't have to get a loan. I had no business debt because of it. And just the whole thing worked out really well, and I can't I can't discount how amazing that was for my growth.
Yeah, you can start. That's a really good way to start if you're just worried about that startup cost. I wrote an article about it probably 10 or 15 years ago. I don't know if you might have even read it. Where do you see chiropractic going in the next 5 years?
It's exciting. I think it's exciting for multiple reasons. Obviously there's some things happening with Medicare. I think we're doing a better job, and that's part of my kind of overall purpose is trying to get more chiropractors getting great information out to the community. Because imagine if all the great chiropractors out there are doing that, how much that will change the game and the perception in the community as far as this is the expert to go to for, say, musculoskeletal care. Because how many times can someone else go to a different provider and not only get evaluated, get a diagnosis, and actually get treated on that same day, right? And treated effectively. So it's very exciting with that. And then I just think overall, we're getting into arenas that we haven't gotten into before. And I know you can attest to that with the VA and with the hospitals. And I just think so many more doors are opening. And once that happens, you're going to start seeing our level of, say, income rise as well.
And also, as the whole country says, who's your chiropractor? Instead of what's a chiropractor. So as we conclude the interview, can you give us one takeaway, what you'd like to leave with the audience, but also tell us the titles of your books and how to get them, and then your contact information?
Yeah, definitely. So one piece of takeaway, it's from a book, but it's called The War of Art, not The Art of War, which is a great military book, right? But The War of Art by Stephen Pressfield. He talks about the resistance in creating. And if you're going to do good content marketing as a chiropractor, you have to think of yourself as a creative, and you're going to face this resistance in your head of getting it done. And so you reference that in your head is like, oh, that's just the resistance that I need to overcome and do it. And so make sure that you don't let that stymie you and get it done. A lot of times chiropractors know what they need to do to have a thriving practice. They just, for whatever reason, they hit that roadblock and don't do it. They hit that resistance. So make sure you overcome that. The name of my book is Doing It Right, Modern Chiropractic Marketing. And you can find that at Parker's online store. They're selling it and shipping it from there, which has been awesome. And you can find me, the Modern Chiropractic Marketing Group, on our Facebook, our closed group. We got over 4,200 chiropractors in there. You could also email me at kevin@moderndeskjockey.com if you would like as well. I still use that email address because it's easy to remember. And I used to have a marketing podcast that was really good for marketing called The Modern Desk Jockey, where I just interviewed people on health and wellness for the desk worker in my community and outside of that. And it was an amazing marketing strategy to not only provide great information, but also build a network of people. Like, it was so much easier to reach out to them about being a guest on my podcast and them saying yes versus saying no to meeting for coffee. Right. Mm-hmm. And so it was a great little Trojan horse in there to interview amazing people. So that's my tip for you, is also consider a local community-based podcast.
Boom. Well, a lot of value bombs in there. Dr. Kevin Christie, we thank you so much for joining us today at Parker Success Academy. And we thank the home audience for joining us, and see you next time.
Thank you. I appreciate it.
Thanks for watching another episode of Parker Success Academy with Dr. William E. Morgan.